My background is as a clinical psychologist, and I did my PhD researching internet treatments for mental health and specifically how to deliver internet treatments to the people that need them. We have an online self-service mental health platform that allows Australian workers to be able to access help when they need it in the workplace without needing to speak to a therapist. I came into my profession as a psychologist because I knew I wanted to help people, but when I found out about how online technology could potentially help more people, I was hooked. I came to the idea because I actually lost a bet with a colleague who bet me that he could treat 20 people in the time that it took me to treat one, using this kind of internet-based application that was pretty rudimentary at the time, and I thought of myself as being a pretty good therapist. But a month later I'd lost the bet. I'd treated one person, he'd treated 20. My results were only a little bit better than his, but at the end of the day I couldn't really argue with the difference. I knew that that was going to be something that I had to pay attention to because it was going to have huge ramifications for the industry, all from losing the bet. Companies at the moment are facing this issue that they don't really have a strategy to be able to detect mental health problems really early in the workplace in a way that's confidential and anonymous. So what they're really looking for is a preventative mental health system. Detect and treat and do it early before it becomes a crisis. Because this is an online treatment, it can be actually performed at 1/8 of the cost of an existing face-to-face or telephone-based counselling treatment. These mental health interventions are really quite expensive. So this is about leveraging technology so that we can help more people and do it at lower cost. The thing that excites me about this is I want to be able to help people, where I could take sitting down with somebody one-to-one at an hour a week, helping that person over 14 weeks, compress that all the way down into a condensed program where I can do it at 1/10 of the time. And so I'm borrowing from what's already known in the science of academia and taking that into business and finding a way to move quickly just as effectively, and I can make a difference to those people. I may not be able to meet all of the people that I'm able to help with technology, but I can sit back and I can look at the data. Even if it's a graph that's going down, that graph really means that there's hundreds of people at a time whose lives are getting better. That's actually really satisfying. What I'm hoping to be able to get out of the next 14 weeks is to test, retest, improve, and to learn all of those skills from the Incubate program in terms of their business expertise, to be adaptable and changeable in a market that is not going to really wait for me if I get it wrong. We're about to release to a focus group testing pilot program and help me to collect data and to make sure that this program is as effective as it possibly can be before we go to a wider release. What I am using the device for is to be able to be the brawn behind the ideas that I've got. For me, being an entrepreneur is about being the brains and the technology is being the limbs. So now I've got a product that's going to enable me to kind of aid everything that I'm doing verbally that's up in my head with something that's visual.